The idea that we are now a few days away from a new administration obviously prompted the really extraordinarily, very enjoyable, and I'm really pleased I had the opportunity to listen to the panel, both of Amy and Ron, and as well as Bill and Dr. Jafari, which really, I think, set the stage for so many of the things that we are going to be dealing with over the coming years. Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with. So for those who think that infectious diseases is gone, there's so many people who've made foolhardy statements not knowing at the time that they made them. I usually show a quote from an old Surgeon General or an old pundit in infectious disease. So I thought I'd pull this one out from Sir MacFarlane Burnet, who was actually a Nobel Prize-winning immunologist, who made the statement, as many did, to write about infectious diseases is almost to write of something that has passed into history. The most likely forecast about the future of infectious diseases is that it will be very dull, which is really kind of interesting coming from a semi-genius like MacFarlane Burnet. And I think what he did, and the mistake that so many people have made, is something that several of our panelists have already referred to. And that is a failure to look beyond our own borders in the issue of the globality of health issues, not only things that are there that will come here, but surprises that we have. So when I think about infectious diseases, I break it down into a few buckets. The established infectious diseases that we know, and when I say I know, we mean that you could reasonably predict today what the disease burden of morbidity and mortality is going to be next year. But there are also other issues that we're talking about now, are diseases that are brand new, that we've never seen them before, or much more common, diseases that reemerge. So let's take a very quick look at established infectious disease and show you what I mean.